Good day, everybody. I'm Joe Eisman. I'm the moderator of LTADchat. And remember, LTADchat is this forum where we share conversations about developing and implementing best practices in youth athletic development and related areas. And on several occasions, I've talked about the importance of implementation. So again, implementation is this process of putting a decision or a plan into effect. It's the execution of the plan. And on most, if not all of the occasions in which I've brought that up, I've mentioned that we really need some guidance from public health in terms of to truly implement long-term athletic development. Now, some of the challenges and barriers that we face are really public health issues. And as I've mentioned before as well, long-term athletic development is so similar to general physical activity, fitness, health, and well-being. It's just really another name and an acronym. Now, part of my interest in involving public health also stems from my education and my past research in epidemiology and public health. But by no means am I an expert like today's guest. Today's guest is my good friend and colleague for nearly 20 years, if not 20 years, Dr. Todd Bartee. Dr. Bartee is a professor at the University of Nebraska-Kearney, where he teaches courses in physical activity and public health. And he's also consulted with numerous end users of the public health model, including work sites, schools, and community and state departments of public health. Todd, so happy that you're with us to share on using the public health model to try to solve some of the issues and problems that we have with implementation of long-term athletic development. Welcome to the show.
Thanks, Joe. Great to be here. Looking forward to it.
Yeah. Hey, before we really get going and before I turn the mic over to you, I just want to state that I think this episode is probably really going to open up future conversations. I don't think this is going to be the first time that you're a guest, because I think, again, public health strategies and models can give us so much insight into implementation. And I'm saying that because we've gone on so many walks and we discussed this intersection of long-term athletic development in this larger field of public health. And I also remember the first time that you heard me talk about long-term athletic development. And in that talk, and when I talk about long-term athletic development, I'll typically say, hey, we know what to do. We just need to do it. And over the last several months, you've really been pressing me a little bit more on that statement. And, I typically come back to you with something related to, hey, we just need to use these public health strategies and interventions in this quote unquote public health process, which I know are out there. But again, I'm certainly no expert. And so again, happy to have you on the show. And kind of to get started here, and you knowing what you know from me in our conversations about long-term athletic development, why don't you talk to us about some of these basic principles of public health and how we can apply them to help implement long-term athletic development, whether that be in a community, in a school, or club. So kind of walk us through, like, we're all in, your public health 101 class. And just as you talk to the students about, hey, these are the necessary steps, or when you consult, right, with a school district for coordinated school health, what are these steps? What are these basic principles of public health that we really need to get a better grasp on, again, if we're truly going to implement long-term athletic development?
Yeah, a couple of things that you've said already, are good lead-ins, if you will, or areas to talk about. And one of the challenges I have when you asked me to do this is there's just a number of frameworks to approach this in terms of problem solving and solution finding. And I think where I'd like to start is coming back to your words of the process, the public health process. And then also you said something that was implementing the plan, which which certainly then means that there's a plan in place, right? And so I'm going to share something here, Joe, if you don't mind. And so this is a schematic that my colleague Tina Hoyle and I developed. And while it's a bit busy, I want to stress just a few things. We'll just come back to this every now and then. But in using some labels, this is the process on the outside here. And this was these labels were first used by Diane Allensworth decades ago in talking about coordinated school health, which was the primary model at the time. This gaining commitment, identifying issues, determining priorities, developing a plan, implementing the plan, evaluating for continuous improvement. Those could take on different labels, right? But we're really talking about doing a needs assessment, asset inventory, working with a population, not on a population. And then we're prioritizing data and setting goals and objectives and a work plan, and then we get to implementation. But the reality is, if we're going to say, oh, what are the steps of implementation? It doesn't start here in step 5. It starts up here in step 1, right? And so just to make you aware of the schematic and what else is here, and then we'll let it go here until it comes up later. These ovals here are the domains of health promotion in that area of work. And so we see this process right here as well, right? Just in different words: assessment, planning, implementation, evaluation. But certainly health promotion, and I guess I should say you use the term public health, and so a lot of my background is in epidemiology like yourself earlier on. But if we look at the 5 core areas of public health: biostatistics, epidemiology, program administration and policy, and then we've got environmental health. And that 5th wedge is community health education or health promotion. And that's where my background and a lot of my experience comes from. And so, we wanted to include these domains of the work of health promotion specialists or health education specialists. And so we see that plan or that process in there. And then lastly, if we look at these concentric circles, just to illustrate that so many times when we're planning to implement an evidence-based strategy, we just think here. And we think, oh, well, if we can just educate knowledge, skills, and abilities, the end user, then we're good. But we got to realize that there's factors that influence individual decisions at all of these different levels. And so when we start thinking about what factors are leading to the problems, but then if we think about who do we need out there as opinion leaders, stakeholders, decision makers, agents of change, partners, we need to be thinking about in a community, and that community could be a school, it could be a town or a city, it could be a team, as we use the term community. But as in this regard, we're really thinking about social norms and then policies at the federal, state, local level that are either being a barrier or could be a facilitator to influencing ultimately individual behavior change. And so that for us, represented the socio-ecological approach. And I'm not going to get into that wording too much today, but it is important that that approach is really widely accepted, and certainly talks about the context of what do we need to know to implement an intervention. So for example, Joe, if we want to implement LTAD in schools, then we're not just going to go to the students, right? We know that if we're talking, whoever might be listening to this, you could be taking on any one of a bunch of different titles, right? From physical educator to health educator to strength conditioning coach to teacher, athletic administrator, whatever that might be. but there's others involved, and others need to be involved. And, here at the organizational level, we know there's factors that are either going to really support this work, right? As you talk with other coaches and teachers and athletic training personnel and so on and so forth. Well, that all depends on the organization's values and, their mission. And so let's go back up here then, saying that to this gaining commitment. First off, I think, to back up just a little bit, the reality is that I believe LTAD, you say two things here. One's a negative a bit, and that is there's an identity issue. So Joe, when we talk, I always have to kind of get my head around LTAD and what it is again, because in my head it's working with youth athletes who want to become bigger, faster, stronger, and I know that's not all of it, but I think that perspective is also very popular in terms of the semantics of LTAD. And I say that because if we're going to go but secondly, then I would say that I think LTAD, in terms of what I know about the outcomes, and let's just use overall fitness as an outcome, and we could call it athleticism. I'm going to say fitness, because from a public health perspective, man, I tell you what, LTAD has a lot to offer, because fitness as a health outcome is so positive, one, with so many positive long-term and short-term outcomes, that there's a lot to sell there, really. The challenge is we're not, we need to make it very clear when we're gaining commitment, what exactly are we selling? And so when we start talking about who do we need commitment for, again, if we go to a school or a work site, we need to look at the organization and know as much as we can about that organization. And so I say that these steps out here, while we have them in a linear and kind of circular alignment here, they're certainly iterative as well. And so I think this gaining commitment and your asset mapping, or looking at resources, what's already going on, understanding the context and the history of the organization, all kind of fit into that gaining commitment. And so, for example, in schools and or work sites, they might already have a wellness program going on. Schools by mandate have to have a wellness policy in place. And that means, on a yearly basis, they should be implementing strategies focused on increasing physical activity, bettering nutrition, and if they want to, other health outcomes as well. So, well, that sounds great, but it would certainly behoove somebody who came in working in a school setting to understand that there's probably people sitting around a table from time to time that are pursuing these same goals and outcomes, just under a different banner, right? And in these days, probably the most popular model, you had mentioned coordinated school health earlier, and that's kind of been taken over here in the last handful of years by a different model, whole school, whole community, whole child. Same idea, but really trying, and I think probably a nice change with the evolution of that model is they brought what I think is really critical, and we've missed this in public health. We miss it in exercise science, but we miss it. I would argue we miss it as health professionals. We spend so much time shouting from the rooftops the benefits of health, and more importantly, the health outcomes, right, of behavior change, that we forget that what are these agents of change, right? If you're talking about a superintendent, a principal, a CEO, a school board, city council, could be Parks and Rec executive board, they've got their own mission, their own vision, their own goals, right? That's most important to them. And we've got to start aligning our work with those outcomes in mind. You know, people don't want to be healthy for the sake of being healthy. They want to be healthy for what it allows them to do and to feel. It's no different for a decision maker or influencer at any one of these levels. An employer arguably doesn't care about his employees or her employees' health as much on its own as it does, how does it affect the bottom line? And that sounds a little cold and obtuse, and certainly it doesn't reflect every CEO's personality, but the reality is we're telling what that can do for how we do our business. And so this gaining commitment is important because one, you got to tell them, exactly what it is that you're talking about wanting to do, right? And this gets into, innovation transfer, right? And adoption, which is one of the first steps of implementation. Someone has to adopt and say, oh yeah, no, I'm ready to support the implementation. And they're going to do that if they're buying into the outcomes and the value add. And again, even in schools, increasing fitness isn't enough, right? It has to be academic achievement and connection to schools and less disciplinary problems and those types of things. And so we need to keep that in mind when we think about LTAD, that we can sell it on all of the good stuff we know that we're increasing in terms of health behaviors and fitness, but we also need to tie that then to whatever that organization's mission and valued outcomes are.
Yeah, can I interject really quick here? Because you finally said a phrase, which is a buzz term these days, along with gaining commitment. Because as soon as I saw gaining commitment, the first thing that came to my mind was buy-in. Like that's a big buzzword, right? In sports right now, with youth sports, strength and conditioning coaches, or whatever. Like, hey, we need to get people to buy into our program, which would be number 4, our plan, right? Because we believe that we have this program, this plan already assembled for the most part. So how do we get this buy-in? How do we gain commitment? That's really what you're talking about there.
Yeah, right. It is. And, so one is understanding as much as you can about that organization that you're talking to, right? Again, and the history, right? I mean, so what else is going on there? You want to be informed. That's important. But we start talking about, I'll go back to schools for an example, because I've just done so much more work there. And I think when I think of LTAD, I think of youth, and I think of, well, where are the kids? But for example, if we're going to get buy-in from a school, well, there's 2 different ways to do that, right? And there's pushing and there's pulling, and so we wouldn't think that we would be cold calling organizations. Organizations, and when I say organizations, obviously I mean the people who are making the decisions for those organizations. They need to be ready to want to change as well. And now they might need some more information to help them make an informed decision that might change their perspective. But I think, Joe, and you can tell me if I'm wrong in the sphere of LTAD, that another common phrase out there is low-hanging fruit, right? The easier wins, so to speak. And so when you're out there approaching potential organizations, who's shown interest, right? And so again, when we're going into a school and that there's a wellness policy there, and you find out who is championing that effort, or even who the school nurse is, and they're telling you who else is involved, and you talk with them a little bit, and they tell you about the challenges and the opportunities of what they're doing, and you're sharing with them a little bit about what LTAD is and your vision for what it could look like in schools. Well, that's all kind of roll up your sleeve background work, right? But that's part of understanding the context, right, of the setting and the population and the history. And And so all of that, just roll up your sleeves, asking questions is really important. And I think the other thing is the idea that we work with people, that we might be content experts in LTAD, for example, as an evidence-based approach or intervention, but we're not experts in that community or that particular organization or what have you. That even if we're a resident of that community, more times than not, we are on the outside looking in, and we need to identify those champions in that organization, whichever organization it might be, and get a better understanding to gain access and entree into that organization. And so that's one step of buy-in. Now, again, I think the specific messages, once that conversation is had, with others that are in that particular organization, well, now you're talking about how does it fit in, because most, whether it's work sites or any organization, schools, when they hear wellness and they hear health, they hear additional programs, right? They're going to take additional resources, whether that's time, space, equipment, money. And so their red flags go up all the time because they're already busy doing what they're doing. And if it isn't broken, then why fix it, right? And so being able to couch what it is, what your product is, what you want to have implemented, and the benefits, we're really selling the benefits again, then how can it be integrated into what they do in a way that is as seamless and as easy and convenient and non-disturbing a way as possible, right? Because also organizations, they absolutely want to be associated with strategies that can have a real positive impact, right? And that's both internally and externally. They can promote and say, oh yeah, and hey, we're doing that, right? Look at all the good stuff we're doing. And so they want to say yes, but but it can't be another thing for them to do, right? And so it must be part of that buy-in as well.
Yeah, and that's no different with coaches either, right? Like, oh, another thing for us to do, we're already wearing enough hats. So I like a lot of the stuff that you've said already, and some of it resonates with, some things that, I've been talking about as well, like win with the winners, right? Like you talk about low hanging fruit. And I'm stuck at number one still, even though I wanted to talk so much about number five, but you can't get to number five and do number five effectively unless you do 1, 2, 3, and 4 effectively, right? So win with the winners. You talked about champions. I always talk about finding a champion in your program, in your school, in your community, right? To have that individual push and then win with the winners. And then, yeah, like the last thing you talked about here was like the seamless integration of it as well, right? Like don't make it too overwhelming. So I like to talk about Rome was not built in a day. Hey, can we add just a 15-minute integrated neuromotor, functional kind of warm up that gets at a lot of these things of athleticism that we want to promote? Like we're not asking you to reconstruct the whole program, but can we seamlessly integrate this, fairly simple, right? Once we take coaches through, this dynamic warm up that really promotes fundamental movement skills and a lot of athletic traits, that can be our gateway, so to speak, into the full implementation of the model as well, because you're going to keep getting buy-in.
Yeah, Joe, something you said, and I think is important. I mean, just to reiterate maybe where this process fits, and that's at the macro and the what I call the micro level, right? And so, when I think of this process, I think of using this work for change in general in schools and school districts and communities. But absolutely, if you're thinking about, well, how do I get commitment of coaches? right? Even if you've got commitment from the school, and then you're working and you're going to try and go add on another school in the district, well, you got to do this too, right? I mean, it's all, what's your plan for those lessons that you're going to do for training up the coaches, right? Where do they need the most help? And what does that look like? And all right, so now we're going to implement this train the trainer, right? Or we're going to train up the coaches. Well, how'd that go? Well, it went pretty well, but then, there was 3 of the coaches that, were sick, that weren't there. And as I did my kind of pop-in observations, I noticed that, really they were probably implementing 60% of what we had talked about at best. And so as we evaluate, well, yeah, maybe it wasn't as effective as you thought it would be because they didn't implement it, as well. But same thing with, working with athletes too, right? If we're going to work with an individual athlete, well, you got to gain commitment, right? Work with them to identify what do we want to improve. They got to be buy-in, right? And what are our goals, right? And are we all in? And now we're going to implement that. And again, how adherent were they to that specific regimen? So the plan is, and again, so, we got these different labels on here, but really, as people are listening to this, I'm sure that they're looking like, oh, yeah, that reminds me of the steps that I go through, right? And when I work with a group or with an athlete or whatever that might be. I think the other thing, from a public health perspective, which again is why I think that public health is interested what LTAD has to offer, is through our conversations, Joe, it seems that, again, it comes back to the semantic issue that this really isn't just about athletes, right? I mean, the benefits, and from a developing talent perspective, it's, hey, everyone's an athlete. And, the movement skills that we're talking about are critical for everyone, from 2 to 92. And obviously that's appealing from a public health perspective as well.
There's another oval on there that I just keep staring at that I think is so critical, and that's leadership. Within oftentimes that organization, right? Like if we just stick with a youth sports program, let's say it's, Kearney Soccer Club or, whatever it might be, like the leadership within that organization or that school, if we're implementing this in a school, becomes so important to hold things together and to do just that, to lead, right? To lead the effort and to stand behind it and to hold people accountable to implementation of the plan.
So Joe, that's really insightful, because when we talk about gaining commitment, one thing we're going to know after let's be positive here and say, oh yeah, they're like, hey, yeah, no, we'll support that, right? And so, hey, and then so usually the next question is, well, how much money do you need, right? So let's just be clear that resources is different than support, right? Oh yeah, here you go, here's a little money. But if they're giving you a little money and a little space, but LTAD doesn't make the agenda on any meetings, and they're talking badly about it or talking about it as an add-on that is just existing over there and you're keeping people happy, well, that's not supporting it, right? And so that leadership buy-in, and commitment needs to not be a one-time thing. And I think that's why if we come back to gaining commitment, I think it's really important. And again, I think we've missed, maybe more in the academic world, but I think everywhere, so many things are grant funded, and, the practice of, when we're working with partners, like, oh, hey, yeah, just write me up a little letter of support. Here are some talking points that you could put that together, and we'll worry about the specifics later, right? Well, then 6 months, a year later, sure enough, you get the grant, and then they're like, oh, what did we say yes to? And then also that, if there's other people who are going to be involved with implementing this, maybe it's not just you. I mean, I'm not exactly sure with LTAD, But if it's not just that one person doing this, well, this commitment up front, they need to have the people on feet on the ground who's going to be helping implement this as a part of that as well. And so I really like the move that I think we're getting a little more progressive with in the area, and that is letters of commitment. And really that kind of before the project, we might call it an MOU at some point, right? If it's a service contract kind of a thing, but really what exactly does this look like? We think we're doing ourselves a favor by glossing over some of the sausage making of some of the challenges that we know is going to be a part of getting it implemented and institutionalized, right? And adopted by everybody in that organization. And so we think we're doing ourselves a favor by not being upfront about that. But the reality is it's just like really pulling somebody into a physical activity behavior change program or a nutrition behavior change program. If you're pulling them in so hard that you've really talked them into it, well, they're not ready, right? They're not ready, and there's not going to be long-term success. So,
yes.
Also, Joe, I just real quickly, I'd also say that leadership in that oval also means leadership development. And so for me and the people that I work with in the space, teaching others how to use this process, right, strategically, and do that work, that's leadership development, right? When you've got coaches and you're training them up on how to integrate a different way of doing things into another system, that is leadership development as well. And I hope that everyone who is looking at making change in organizations, you're taking on a leadership role, absolutely, and you should embrace that. So anyways, it's there in kind of both ways: leadership development, but also this understanding as it ties back to commitment.
Yeah. Before we summarize, are there any other pieces of this model that you haven't talked about that are important, or important enough to kind of give another mention as, a basic principles of using this model and this framework?
Well, I think, what we've been talking about quite a bit so far has been, in my mind, thinking about one intervention strategy that's going to get adopted and maybe adapted into an organization. And so that's kind of, that's different than, let's say, just again, from our past conversations, Joe, I know this also has the potential to be something that's community-wide, right? And have this synergistic impact. And if that's the case, then obviously, I mean, certainly partnerships plays a part as well. And we start thinking about community. Again, one thing that we don't do well, I don't think in lots of areas of work, is the left hand and the right hand in an organization, in a community, talking to each other. And so, for example, there's a lot of, in any community, there's a lot of things out there that it could be Parks and Rec, right? It could be youth sports. It could be high school, and it could be elementary PE and recess and high school athletics. And maybe there's a couple intramural programs there. And the YMCA is doing some things. The fitness clubs are in town. A couple of other non-for-profits kind of doing their thing. But they're not talking to each other, right? There's no synergy. There's no common message. There's no common goal. And so to bring it back to a sport metaphor, like, there's nothing wrong with that per se, because it's all moving forward, but it's not a team approach, right? They're all moving common goals, but they don't have to rely on each other to meet shared goals. And so we can think about this entire process and everything we talked about today from, if anyone out there is listening, from, God, how do I get this more diffused and adapted throughout my community, then certainly this process holds true for that as well.
Yeah, this has been great. And again, I think this is really going to be the first of many conversations because this is so important in terms of where we are in our space right now with long-term athletic development. Maybe as we close though, for the listeners, just so we're clear and maybe a summary here, you know, a checklist. Can we provide them a checklist? Like, okay, if you like what's been said today, what's been discussed today, and you want the big nuggets, right, to take back and talk further with maybe your athletic director, other coaches in the organization, and you would say, okay, when you go back, here are the 3, 5, 6 things that maybe we'll call a checklist, right? Here's our our to-do checklist for the implementation of long-term athletic development using this framework, this model that's in front of us right now. What do you have for us as a checklist of key items?
Yeah. So, I think I would say, am I being clear about exactly what it is that I'm asking to for support, right? And what it looks like. And am I selling the right thing, right? Am I selling outcomes that are 30 years down the road here, or am I selling short-term outcomes that are valuable to the organization that I'm working in? And so I think that's one thing. I think the other is am I working with people and not at or on people? And that you don't, try and find that core group, right? I mean, even if that's one other person or two other people, and don't be scared to, if it's early in the process, don't be scared to just roll up your sleeves and have the conversations. I think coming back to leadership, I think being able to say, admit that you don't have all the answers, right, is just it just empowers the people around you, right, that they have something to contribute. And so while I think you need to be prepared if you're going to go get commitment in this process, you don't need to have all the answers. I mean, I'm about ready to go down another road here, Joe. We would miss, right? Sorry, it would not be correct for us to go into an organization and say, hey, I know exactly what evidence-based interventions you need in this school. To use a school example, we need running clubs before school. We need after-school physical activity programs. We need to change recess to be semi-structured, and we need to be doing take 10s in the classroom, and so on and so forth. How would we know that if we've never took the time to identify issues, determine priorities, and we did that with the people who are actually in the organization, right? So we know what we know, but what it looks like in that context, we've got to work with the people. And then they're part of the solution. You talk about buy-in, they're part of the solution. Ask them, what outcomes would you need to see as a stakeholder in this position, right, to support this over the longer term? Well, then you do your best to set it up to be able to measure outcomes in that area, right? And so now you've got your stakeholders who, maybe they're on the fence, but they've told you, hey, if we can get these outcomes, I'm in, right? So those would be a few, Joe. And I really think that if you can just back up and step up a little bit to out of the day-to-day, and think about it from how others see this great, shiny, perfect solution, and how they see it, right, invading their organization, right, then that could be beneficial.
Great. Hey, as we close out here, how can listeners find out more about you or contact you if you're willing to share some contact information?
Well, that's a great question, Joe. And I don't mean that flippantly. I mean, I'm not exactly sure. I wasn't prepared to have a business card flash up on the screen here. So, Joe, I'm perfectly okay with that. Can you tell me what would be?
Email address, like if they're interested just to share a
Sure,
conversation with you about this, can you provide an email address, telephone number at your office? Any,
sure. Yeah, so my last name is Bartee, and this is the email address here, Bartee, the letter T for Todd, and the number 2. So Bartee, T2 at unk.edu. My office number is 308-865-8179.
you had to think about that because we never call ourselves, right?
I did. Yeah, that took a second. It was obvious in my head. I'm glad that it showed that it was obvious as well.
Yeah. Hey, thanks for taking the time to really walk us through this model and really provide some great insight for those of us who we're ready to go. Like we want to get into these communities and schools and implement long-term athletic development. So I think this has been really helpful.
Yeah, Joe, when we talk, Joe, there's so many overlaps with with what you bring to the table, what I bring to the table. And so I would just, I apologize for interrupting, but in terms of partnerships, in your community, be looking for that person who, might have a similar background as I do in, the process of health education, public health promotion. They exist out there. It could be at a public health department or other organization. But yeah, look for those folks that are, as my mentor would say, it's all about the process, stupid. So I think it's work in the process that's important.
Yeah, super. So again, thanks for sharing this process with us. I think we're going to have a few things to revisit. One thing that comes to my mind is maybe a really concrete example that you've been through, maybe that you've, and walk us through each of the steps, like, very specific detail about how it was actually implemented within a school or a work site or wherever it might be, because again, lots of parallels in terms of what we're trying to do. So again,
Yeah.
thanks for being on the show. Everybody have a great day. And yeah, you can visit us at LTADchat on YouTube.
Thanks, Joe. Appreciate it. It's been fun.